Have you noticed your blood sugar skyrocketing after meals, no matter how carefully you choose your foods? What if I told you that taking just 2 tablespoons of apple cider vinegar before eating could reduce those post-meal glucose spikes by up to 30%? And there's solid scientific research to back this up. I'm Dr. James Wilson, and over the past 13 years working with people managing type 2 diabetes and prediabetes, I've seen how simple interventions like apple cider vinegar can make a dramatic difference in blood sugar control. Today, I'm going to share exactly how apple cider vinegar works to blunt glucose spikes, the best way to use it, what the research actually shows, and the real results my patients have experienced. This isn't some internet fad or miracle cure, but a legitimate, evidence-based strategy that can complement your existing diabetes management plan. Before we dive into the specifics, I need to mention something important. Everything I'm sharing today is for educational purposes and shouldn't replace professional medical advice. Always discuss any new supplement or dietary strategy with your healthcare provider before starting, especially if you're taking diabetes medications or have other health conditions. I remember when Sandra, a 63-year-old woman with prediabetes, came to my office concerned about her post-meal blood sugar readings that were consistently spiking above 180 milligrams per deciliter, even when she ate what she thought were healthy meals. She was terrified of progressing to full-blown diabetes like her mother had. After reviewing her situation, we incorporated apple cider vinegar into her routine, having her take 2 tablespoons diluted in water about 15 minutes before her lunch and dinner. Within just 3 weeks, her post-meal spikes dropped to the 140 to 150 range, and after 2 months, her fasting glucose had improved from 118 to 102 milligrams per deciliter. She couldn't believe something so simple and inexpensive could have such a measurable impact. Let me explain the fascinating science behind why apple cider vinegar works so effectively for blood sugar control. The active compound responsible for most of the benefits is acetic acid, which makes up about 5 to 6% of apple cider vinegar. Acetic acid works through several mechanisms to improve glucose metabolism. First, it slows down the digestion of starches by inhibiting enzymes in your digestive tract, particularly one called amylase that breaks down carbohydrates into simple sugars. When carbohydrate digestion is slowed, glucose enters your bloodstream more gradually, rather than flooding in all at once and causing those dramatic spikes. Second, acetic acid appears to improve insulin sensitivity in muscle tissue, which means your muscles can take up glucose from your bloodstream more efficiently. Third, research suggests that acetic acid may reduce glucose production in the liver, which is important because the liver can release stored glucose at inappropriate times, contributing to elevated blood sugar levels. Finally, apple cider vinegar may slow gastric emptying, which means food stays in your stomach longer before moving to your intestines, where nutrient absorption occurs. This delayed emptying contributes to a more gradual rise in blood sugar after meals. The research supporting apple cider vinegar for blood sugar management is actually quite impressive. A study published in the journal Diabetes Care involved 11 people with type 2 diabetes who consumed 2 tablespoons of apple cider vinegar before bed. The next morning, their fasting blood glucose was 4 to 6% lower compared to when they took water instead. Another study from the European Journal of Clinical Nutrition had healthy subjects consume vinegar with a high carbohydrate meal. Those who took vinegar showed a 31% reduction in blood glucose response compared to the control group. Perhaps most compelling is a study from Arizona State University that followed 29 participants, some with type 2 diabetes, some with prediabetes, and some who were healthy. All groups showed improved insulin sensitivity and significantly reduced blood sugar spikes after meals when they consumed apple cider vinegar before eating. The prediabetes group saw particularly dramatic improvements, with post-meal glucose levels dropping by nearly 34%. A meta-analysis reviewing 9 clinical trials with 317 participants concluded that vinegar consumption significantly reduced both fasting blood glucose and HbA1c levels in people with type 2 diabetes. By the way, if you're finding this information valuable and want more practical, evidence-based strategies for managing your blood sugar, I'd really appreciate it if you'd subscribe to James-Diabetes Expert and hit that notification bell. I share research-backed approaches like this every week that can genuinely help you take control of your diabetes and improve your quality of life. Now let's talk about exactly how to use apple cider vinegar properly, because the method of consumption matters for both effectiveness and safety. The standard dose that research supports is 1 to 2 tablespoons of apple cider vinegar taken before meals, typically 15 to 20 minutes before you start eating. Never consume apple cider vinegar straight or undiluted because the acidity can damage your tooth enamel, irritate your throat and esophagus, and cause stomach discomfort. Always dilute it in at least 8 ounces of water. Some people prefer to mix it with 10 to 12 ounces of water to make the taste more tolerable. You can start with 1 tablespoon if you're new to apple cider vinegar, and gradually increase to 2 tablespoons as your body adjusts. The timing is important. Taking it 15 to 20 minutes before your meal gives the acetic acid time to start affecting the digestive enzymes before food arrives in your stomach. Taking it during or after a meal is less effective. When choosing apple cider vinegar, look for raw, unfiltered, organic varieties that contain what's called the mother. The mother is a cloudy substance that forms naturally during fermentation and contains beneficial enzymes, proteins, and friendly bacteria that may provide additional health benefits beyond just the acetic acid. Brands like Bragg's are popular and widely available, but any raw, unfiltered apple cider vinegar with the mother will work. Avoid filtered, clear vinegars or those with added sugars or artificial ingredients. You can find quality apple cider vinegar at any grocery store, health food store, or online for just a few dollars per bottle. One of my patients, Richard, a 58-year-old businessman who traveled frequently for work, struggled with blood sugar control because of irregular meal times and limited healthy food options on the road. He started keeping a small bottle of apple cider vinegar in his briefcase and would mix it with water at restaurants before eating. Even when he had to eat less than ideal meals at airports or business dinners, his post-meal blood sugar readings improved significantly. His average post-meal spikes dropped from around 200 milligrams per deciliter to about 155 milligrams per deciliter within 6 weeks, and he felt he finally had a practical tool he could use consistently, regardless of his circumstances. Here's what I tell my patients about realistic expectations and timelines. Unlike pharmaceutical medications that can show effects within hours, apple cider vinegar's benefits on fasting blood sugar and HbA1c build up gradually over several weeks. However, the effect on post-meal blood sugar spikes can be noticeable much sooner, sometimes within days of starting. Many of my patients report seeing measurably lower post-meal readings within the first week or 2. For improvements in fasting blood sugar, you typically need 4 to 6 weeks of consistent daily use. HbA1c improvements, which reflect your average blood sugar control over 3 months, usually become apparent after 2 to 3 months. The key to success is consistency. Using apple cider vinegar sporadically won't give you the results you're looking for. You need to make it a habit before your main meals, every single day. Most people find it easiest to use apple cider vinegar before lunch and dinner, which are typically the largest meals containing the most carbohydrates. Some people also use it before breakfast, if that's a meal where they struggle with blood sugar spikes. You don't necessarily need to use it before every single meal if you're eating small snacks throughout the day, but definitely before your main carbohydrate-containing meals. I recommend starting with just 1 meal per day, perhaps lunch or dinner, to see how your body responds and to get used to the taste. After a week or 2, you can add it before a second meal if you're tolerating it well and want to maximize the benefits. Speaking of maximizing benefits, I share these kinds of detailed, practical implementation strategies regularly on this channel. If you're getting value from this information and want to stay updated on the latest diabetes management techniques backed by real science, please hit that like button and consider sharing this video with anyone you know who's dealing with blood sugar challenges. The more people who understand evidence-based approaches like this, the better. Beyond blood sugar control, apple cider vinegar offers several additional health benefits that make it particularly valuable for people with diabetes. It has been shown to help with weight management, which is crucial since excess weight contributes to insulin resistance. A study published in Bioscience, Biotechnology, and Biochemistry found that people who consumed vinegar daily for 12 weeks lost more weight and belly fat compared to those who didn't. The acetic acid appears to increase feelings of fullness and reduce appetite, leading to lower calorie intake throughout the day. Apple cider vinegar may also improve cholesterol levels. Several studies have found that vinegar consumption can lower total cholesterol and triglycerides while raising HDL, or good cholesterol. Since cardiovascular disease is the leading cause of death among people with diabetes, anything that improves your lipid profile while helping with blood sugar is especially beneficial. Some research also suggests that apple cider vinegar has antimicrobial properties and may support digestive health by promoting the growth of beneficial gut bacteria. Now let's address important safety considerations and potential side effects. Because even though apple cider vinegar is generally safe for most people, there are situations where caution is needed. The most common side effects are digestive in nature. Some people experience nausea, indigestion, or upset stomach when they first start using apple cider vinegar, especially if they take too much too quickly or don't dilute it sufficiently. If this happens to you, reduce the amount to 1 tablespoon or dilute it in more water until your system adjusts. The high acidity can also cause throat irritation or a burning sensation in the esophagus if consumed too concentrated. This is why dilution is absolutely essential, and I recommend drinking it through a straw to minimize contact with your teeth and throat. Apple cider vinegar can erode tooth enamel over time due to its acidity, so after drinking it, rinse your mouth with plain water and wait at least 30 minutes before brushing your teeth. Brushing immediately after can actually worsen enamel damage because the acid temporarily softens the enamel. Some people prefer to drink their apple cider vinegar mixture through a straw, positioned toward the back of the mouth, to minimize contact with teeth altogether. If you have gastroparesis, which is delayed stomach emptying that can occur as a diabetes complication, apple cider vinegar might worsen this condition since it further slows gastric emptying. Check with your doctor if you have this condition before using vinegar therapeutically. At this point, let me address something crucial about medication interactions. Apple cider vinegar can enhance the effects of diabetes medications, particularly insulin and medications like glyburide or glipizide that increase insulin production. This means there's a real risk of hypoglycemia or dangerously low blood sugar if you're not careful. You absolutely must monitor your blood sugar closely when starting apple cider vinegar and work with your healthcare provider. Your doctor may need to adjust your medication doses as your blood sugar control improves. Apple cider vinegar can also interact with diuretics and medications that lower potassium levels. The combination could lead to potassium deficiency, which can cause muscle weakness, cramps, and heart rhythm problems. If you're taking any of these medications, have your potassium levels monitored regularly. I recently had a patient named Margaret, a 69-year-old woman taking insulin for her type 2 diabetes, who started using apple cider vinegar before meals without telling me first. She was thrilled when her blood sugars started dropping, but didn't adjust her insulin doses. Within 2 weeks, she had several frightening episodes of hypoglycemia, with readings in the 40s and 50s, causing confusion, shakiness, and sweating. Once we realized what was happening, we reduced her insulin doses and had her continue with the apple cider vinegar under close monitoring. Her blood sugar stabilized beautifully in the target range without the dangerous lows, and we were eventually able to reduce her total daily insulin by about 20%. This example shows both the potential benefits and the critical importance of medical supervision. Let me share some common mistakes people make with apple cider vinegar, so you can avoid them and get the best results. The first major mistake is thinking apple cider vinegar will allow you to eat whatever you want without blood sugar consequences. I've had patients who thought they could take apple cider vinegar and then eat a huge plate of pasta or a dessert without any impact on their glucose levels. That's not how this works. Apple cider vinegar helps reduce the blood sugar spike from whatever you eat, but it can't completely eliminate the effects of high carbohydrate, high sugar meals. You still need to follow a diabetes-friendly diet that emphasizes whole foods, vegetables, lean proteins, healthy fats, and limited refined carbohydrates. Think of apple cider vinegar as a helpful tool that makes your good dietary choices even more effective, not a free pass to eat poorly. Another mistake is taking too much apple cider vinegar, thinking more is better. Some people figure if 2 tablespoons help, then 4 or 6 tablespoons must be even better. This is dangerous. Excessive vinegar consumption can lead to low potassium levels, bone loss, and serious digestive problems. Stick to the research-supported dose of 1 to 2 tablespoons before meals, and don't exceed that amount. People also make the mistake of consuming it undiluted or insufficiently diluted, which can cause throat burns, esophageal damage, and tooth enamel erosion. Always dilute your apple cider vinegar in at least 8 ounces of water, and consider using a straw for added protection. Many people also give up too quickly when they don't see immediate dramatic results. Remember that while post-meal blood sugar improvements can happen relatively quickly, improvements in fasting glucose and HbA1c take several weeks to months of consistent use. Give it at least 6 to 8 weeks before deciding whether it's working for you. Keep a detailed blood sugar log so you can track trends over time rather than fixating on day-to-day fluctuations. Some people also make the mistake of using apple cider vinegar as a replacement for their prescribed medications rather than as a complement. Never stop or reduce your diabetes medications without your doctor's guidance, even if your blood sugar improves with apple cider vinegar. Work with your healthcare team to make any medication adjustments safely. Let me give you a step-by-step implementation plan that I share with my patients. First, purchase a bottle of raw, unfiltered, organic apple cider vinegar with the mother from your local grocery store or health food store. Bragg's is a reliable brand, but any quality raw vinegar will work. Store it in a cool, dark place like your pantry. Get a small glass or cup that you'll designate as your apple cider vinegar glass, and keep it in an easily accessible spot in your kitchen. About 15 to 20 minutes before lunch, pour 8 to 10 ounces of water into your glass and add 1 tablespoon of apple cider vinegar. Stir it well and drink it, preferably through a straw. Check your blood sugar 2 hours after eating and record it in your log. Do this before lunch every day for the first week. After a week, if you're tolerating it well and not experiencing any digestive issues, add a second dose before dinner. Again, mix 1 to 2 tablespoons in 8 to 10 ounces of water and drink it 15 to 20 minutes before eating. After 4 weeks of consistent use, review your blood sugar log to see if there's a downward trend in your post-meal readings. Compare your average post-meal numbers from before you started apple cider vinegar to your current averages. Most people see a noticeable improvement by this point. Continue the routine for at least 8 to 12 weeks, then have your doctor check your HbA1c to see if there's been an improvement in your overall blood sugar control. Share your blood sugar logs with your healthcare provider so they can assess whether any medication adjustments are needed. If you find the taste of apple cider vinegar in plain water too unpalatable, there are ways to make it more tolerable. You can add a squeeze of lemon juice, which adds a pleasant citrus flavor and additional vitamin C. A small amount of cinnamon powder can be mixed in, giving you a double dose of blood sugar lowering compounds. Some people add a tiny bit of stevia or monk fruit sweetener to take the edge off the acidity, though I generally recommend getting used to the taste as is if possible. You can also drink it as a warm tea, by mixing it with warm water and a slice of fresh ginger. In summer, you can make it cold by adding ice cubes and a sprig of fresh mint for a refreshing drink. Beyond just taking apple cider vinegar as a drink, you can incorporate it into your diet in other ways to maximize its benefits. Use it as the acid component in salad dressings, combined with olive oil, herbs, and a touch of Dijon mustard. Add a tablespoon to marinades for chicken, fish, or vegetables. Use it in homemade pickles or as a tangy addition to soups and stews. The more ways you can include apple cider vinegar in your daily routine, the better your results may be, as long as you stay within safe total intake levels. Just remember that consuming it before meals in diluted form is the most effective method for blood sugar control. What I find particularly powerful about apple cider vinegar is how it gives people a sense of control over their diabetes management. So many of my patients feel helpless and frustrated when their blood sugar remains high despite their best efforts. Having a simple, inexpensive, evidence-based strategy like apple cider vinegar that they can implement immediately provides hope and empowerment. It's not about rejecting conventional medical treatment, but about enhancing it with complementary approaches that work synergistically to improve outcomes. The affordability factor is also significant. A bottle of quality apple cider vinegar costs around $5 to $8 and can last you several weeks. Compare that to the cost of additional medications or the long-term cost of diabetes complications, and you can see why exploring safe, accessible options like apple cider vinegar makes tremendous sense. This is especially important for people on limited incomes or those without comprehensive health insurance. Everyone deserves access to tools that can improve their diabetes control and quality of life. Before I wrap up, I want to emphasize realistic expectations one final time, because this is crucial for your long-term success and satisfaction. Apple cider vinegar is not a cure for diabetes. It will not eliminate your need for healthy lifestyle choices or prescribed medications. What it can realistically do is reduce your post-meal blood sugar spikes by 20 to 30%, potentially lower your fasting glucose over time, possibly improve your HbA1c by 0.3 to 0.7% over several months, and maybe allow your doctor to reduce your medication doses as your control improves. These are meaningful, achievable outcomes that can significantly impact your long-term health and reduce your risk of diabetes complications like nerve damage, kidney disease, vision problems, and cardiovascular disease. You're taking your health seriously by seeking out evidence-based information, and that matters. Managing diabetes requires a multifaceted approach that includes proper nutrition, regular physical activity, adequate sleep, stress management, appropriate medications when needed, and helpful adjuncts like apple cider vinegar. When you combine all these elements consistently over time, you create powerful synergistic effects that can transform your health outcomes. Apple cider vinegar is one valuable piece of that larger puzzle. Oh, and one more thing before you go. I'd love to hear from you in the comments below. Are you going to try apple cider vinegar before meals? Have you already been using it for blood sugar management? What kind of results have you experienced? Drop a comment and share your story, because your experience might inspire or help someone else in our community. And if you haven't subscribed to James-Diabetes Expert yet, please do so now and turn on notifications so you don't miss future videos where I share more practical, science-backed strategies for living well with diabetes. Your health journey is important, and I'm committed to providing you with information you can actually use to improve your life. Start tomorrow with your first dose of apple cider vinegar before lunch. Be consistent, monitor your blood sugar carefully, stay in close communication with your healthcare team, and give it time to work. Small, simple actions repeated consistently over time create remarkable transformations. You have more control over your diabetes than you might think, and tools like apple cider vinegar can help you exercise that control effectively. You've got this, and your future self will thank you for the positive steps you're taking today to protect your health and improve your quality of life.